Welcome to today's presenter interview for the Attorneys Resource Conference, or as you're hearing it, ARC 2026. ARC 2026 is all about bringing attorneys, legal nurses, healthcare professionals, providers together to improve strategy in case litigation, improve professional practice and patient care outcomes, and to improve the ability to identify and mitigate risk. You can go to attorneysconference.com, just enter that right into your Google search engine, or go ahead and use the QR code down on my screen to register and make sure that you get your tickets for this event happening August 11 through 13, 2026. And today we have with us Dr. Stephen Cohen. He is going to do an introduction. Hello, Dr. Cohen. How are you?
I am great. Thank you so much.
Wonderful. We're excited that you will be joining us again this year. Can you tell us a little bit about yourself and what kind of work you do?
So, I am a board certified general and colon and rectal surgeon, as well as a medical legal consultant. My work really sits at the intersection of clinical care, surgical education, as well as litigation. And the two worlds collide, right? Because in the operating room, I manage complex colorectal diseases and emergencies. And in the courtroom, or when asked to review a case, I analyze whether those decisions that were made under uncertain conditions met the standard of care. So my focus really at this point is to translate real world clinical decision making into language that the courts, that the attorneys, that the juries can understand without oversimplifying the medicine.
That's wonderful. And we have had the opportunity to hear you speak last year in Detroit at our conference there. What drew you to come back this year and present again at ARC 2026?
So that's a great question. I mean, ARC 2026 is going to bring together clinicians and legal professionals who are serious about understanding how medicine actually functions under pressure. Most conferences discuss outcomes. ARC, however, focuses on decision making. And that alignment is rare, but it's necessary because the medical legal failures often don't arise from incompetent practitioners, but from misunderstandings about how clinical decisions are actually made in real time.
I agree. I'm excited. I'm really looking forward to hearing you speak again. You do such a fabulous job. Can you give us a little bit of insight about your topic without giving too much? And what is the risk if we don't address your topic?
Yeah, another great question. So my session is going to really examine colorectal emergencies through a medical legal lens. I'm going to show how decisions made in uncertainty, i.e., perforation, sepsis, bowel obstruction, ischemia, are later judged with hindsight, but that's often unfair to the team taking care of the patient. I'm going to break down where the clinical reasoning diverges from legal interpretation, as well as offer a framework for distinguishing reasonable judgment from true deviation from the standard of care. And, as you know, colorectal emergencies are high stake, time sensitive, and can be clinically ambiguous. When hindsight replaces context, reasonable care is going to be mischaracterized as negligence, or genuine failures are going to be misunderstood. So the risk is really twofold. Number one, clinicians practice defensively rather than thoughtfully, and the legal system evaluates medicine through an unrealistic lens. Both outcomes harm patients and potentially can distort justice.
So if I'm sitting in the room, which I will be, what do you want me to think or feel or how to act differently after your session? What is it that you would like to see attendees take from this?
I want attendees to slow down before labeling outcomes as errors, or in the reverse. Sometimes a bad outcome is a breach in the standard of care. So it's important at the end of my session or all of these sessions to ask yourself, number one, what was knowable at the time rather than what do we know now? Because when all of us are asked to review cases, we have the autopsy report. We know the outcome, but you have to put yourself in the provider's shoes, knowing what they know and not knowing what the outcome is. I want them to leave with a sharper ability to separate poor outcomes from poor decisions. That's really the bottom line, because that distinction is the foundation of credible medical legal analysis.
So, what do you think is the most misunderstood aspect of the topic that you're presenting on?
So many people, attorneys, other doctors including, assume that clarity emerges earlier in clinical care than it actually does, right? Because you review a chart, you already know the outcome. But in colorectal emergencies, signals can be very subtle, they can be contradictory, or they can evolve over time. Medicine is not binary, it's probabilistic. The biggest misunderstanding is believing that the right answer was obvious in real time when in fact it often wasn't.
Mhm. Okay, so who are the most important people that should be in the room to hear this presentation?
Surgeons, emergency room physicians, hospitalists, risk management, attorneys, expert witnesses, legal nurse consultants, anyone involved in evaluating adverse outcomes. Chart review, whether it's personal injury cases, whether it's medical malpractice cases. If you assess clinical decisions after the fact, whether in court, peer review, quality improvement, this session is directly relevant.
Okay, we're excited that you're going to be joining us, and just listening to you talk, I cannot wait to hear your presentation. So, when you think about after you've experienced ARC 2025 and you now think about joining us at ARC 2026, what is exciting you the most?
The opportunity to really move beyond an adversarial narrative and towards shared understanding. Because as you know, whatever side I'm on, it's very adversarial and it's not very friendly. So when clinicians and legal professionals can speak the same language about uncertainty, about risk, about decision making, the quality of both medicine and justice improves. ARC 2026 creates that conversation.
I agree. And I think it just improves client outcomes all around, whether you're in a clinical setting or a legal setting, and we have so much to learn from each other. So I'm really looking forward to that same opportunity. So I would like to thank you if you have taken time to watch this video and to meet Dr. Cohen, not yet formally, but to have an opportunity to meet him in Grand Rapids, Michigan. August 11 through 13, 2026. Please again go to attorneysconference.com or use the QR code to book your seat. Tickets are going fast, and we want to make sure that we have room for you.